what do you think the future of cancer treatment will look like? Will it be a combination of all of them, or is there a few that
Yeah.
stick out as the most promising technologies?
I think as a CAR T cell researcher, I'm inclined to say that CAR T cells will be the revolutionary cancer treatment that changes the field once they get going. And also, by the way, they're becoming more and more easy to there's this whole new field called in vivo generation. So instead of making them outside the body, you give somebody an injection that kind of inside your bloodstream will just make your white blood cells start producing this receptor. Again, it's tricky to make this happen and make it work as a certified medicine. But, can you imagine when that gets approved? You just go to the GP and get an injection from the fridge, and they'll be, oh, yeah, let me just make your immune cells kill cancer. Here you go. Okay, see you later. Should be cured within a couple of weeks.
Yeah,
That's
that is
the dream.
incredible.
That's the dream.
Yeah, world-changing technology. How many years into the future will this happen, and how expensive will it be?
Well, as I say, the antibody type therapies like checkpoint blockade inhibitors and some of the other ones, like just monoclonal antibody treatment, these are being used right now, and they're very commonplace and they're pretty cheap. Things like the CAR T cell therapy, they are being used even in the NHS for certain conditions, but they are very, very expensive. They're like hundreds of thousands of pounds per patient.
But this is at the moment.
This is at the moment. As I say, people are working really hard to get those costs down, but I think it's going to be, maybe these things work pretty slowly. So I think you maybe see another 10 years before this stuff starts to become more commonplace. And it's a bit like slowly turning the temperature up. You don't really notice it until it's everywhere. So one day we're probably going to look around us and be like, oh, it's pretty easy to get revolutionary immunotherapy in the hospital these days. I mean, we didn't even have a news story about it, I think it's going to be one of those things that creeps up on us until we realize 20 years later that we've got thousands of these new treatments everywhere, relatively easy to access. And suddenly we've got a whole new world of cancer treatment to 20 years in the past. So I think in 20 years' time, if we look back at current treatments versus then, it's going to be so different. It's going to be the biggest revolution in cancer treatment ever. But we're at that stage now when all these things are being tested and going through this really slow regulatory process where you have to be approved here and show that it works. And if it doesn't work, you've gone through all the clinical trials and then you try it and it doesn't work as good as that. It can tank the whole thing. We're getting through those barriers, but once they become cheaper and a bit more consistent, it's going to be completely game-changing for cancer therapy. And those older treatments probably aren't going anywhere. They're way cheaper. They're way more established. Probably we're just going to combine all of them. You give somebody surgery to get rid of most of the tumor, then you give them a CAR T cell dose to destroy all the cells and have a memory response, maybe a radiotherapy blast to get rid of the rest of the tumor mass at the site. And then the CAR T cells can be the longer term memory induced state where the cells will last for a long time, years. They'll be in your body, making sure the tumor doesn't come back. So you can imagine a world where we combine these things together, how effective that could be. I don't think we're ever going to cure cancer because, as I say, it's a very diverse disease. Sometimes you don't notice it until it's too late. Sometimes you just happen to have a set of mutations that's really hard to treat. But we're going to get a lot better at curing a lot more people. And we're going to get to a world where maybe cancer is a dangerous but usually manageable disease rather than a really dangerous and sometimes manageable, sometimes not disease.